Health.
Health. It's about health. Yes. It's all about health. Do you still remember what is our topic last week? You still remember? It's all about the...
Teacher. Teacher.
Hello? You're there. You're alive. Nawin? Okay, so do you still remember what is our topic last week about the health? Do you remember? Do you still remember? It's not, right? Okay, I would like to remind you if what was that what we have studied. Do you know what did the video that I showed you last week? If you remember it. What is all about the video that I showed you? It's all about, again, China Chart? The chips. It's all about the chips. The alternative way of having a chips. What else? You cannot remember? The alternative way of having the juices that you cannot drink always cola, so that you will going to make alternative way to prevent the illness. You didn't remember? So that prevent illnesses. That's why you should eat proper diet, sleep well. There's a lot of ways so that you can prevent illnesses. That's why I am encouraging you the proper eating of foods, eating of healthy diet. That's why I am encouraging you, just because of that one. I want you to become healthy. I don't like that you will be sick. But that's why I always encourage you to have a healthy diet. Okay? So let's continue that one, because some pictures send me. Some of your classmates send me the pictures. So now I showed it yesterday that her mom sent a picture in the group that he is eating vegetable salad. So who among you from the class eating vegetable salad? Who want to eat vegetable salad? Does anyone want to eat vegetable salads among of you? Who? Okay. Yeah. So it should be, if you have, what do you call this? If you have time, you can make your vegetable salad. It's good. It's yummy. You have a lettuce. You have some corn, fresh corns, beans. You can make your own salad. You can make your own juice, like lemon juice. You can make orange juice. You can make carrot juice. You can make your own juice. The same as Ranchida. She make her juice. Pineapple, apple, cucumber, carrot. She do her own juice. So you can do it also to your house. It's good to have a fresh juices, so that you will not be easily get sick. So that you will not be easily get sick. Okay, so let's continue now for this one. So we are done already with the some prevention of the illnesses. So let's go on to the topic. So here, as you can see in the spoon, inside the spoon, what do you think? What are this? What do you think? What are those? What are those inside the spoon? Do you know what are those? They are the drugs or medicines. You call them drugs or medicines. So here, see, illnesses, remember, illnesses are caused by, what is it? By germs. So one cause of illnesses is by germs, while injuries are caused by accidents. So remember this one, illnesses caused by germs, injuries caused by accident. And some common illnesses and minor injuries can be treated at home. Let's know more about them and treatment. Like for example, for illnesses, you have a stomach ache. That is one kind of illness, stomach ache. Why you have stomach ache? Because you eat some street foods that is contaminated with germs. So you have a stomach ache. You can drink a medicine from the stomach, like Sara. That's for pain. So we can what do you call this? We can cure that one in the house. And for injuries, what kind of injuries? You're playing and you fell off on the floor and you have some wounds. So you can put medicine in your house. You can cure it in your house. You can put plasters in your house. Betadine, you can put in your house. So that's are the injuries that we can be treated at home. But the major, that's only minor, but for the major problems, major illnesses, major injuries, you need to go to the hospital. The hospital will be treated you. You cannot treat at home. Like for example, you have a major accident, or you have a major illnesses. Like for example, you have acute urinary tract infection, meaning to say,
Yeah.
yes,
My dad buy me some corn juice.
yeah, that's good. Corn juice, very good.
My daddy just buy some corn juice for me.
Okay, very good. Say thank you to your dad. At least he bought you a healthy juice. Say thank you to him. Oh, see, that's what I am trying to encourage you to have a healthy diet so that you will prevent from illnesses.
Go to work now.
Okay, when he went back home, you can say thank you with him.
At night.
He buys you something. He buys you a healthy juice. Okay, so let's continue. So remember that one class, that's are the minor injuries, and for major injuries, you need to go to the hospital. As again, acute urinary tract infection. So what are those? What are some causes of that acute urinary tract infection? Meaning to say it's very painful of that one. You cannot pee. You cannot pee. Yes. You will pee blood. Why? What is the reason why you have acute urinary tract infection? Why that one? Why that illness? Just because I will give you what is the reason why mostly of that illness. Just because you're eating too much chips. You're eating too much cola. You're eating too much salty food, not only chips, but foods that is too much with salt. Yeah, that are some major cause of that illness, acute urinary tract infection.
I forgot to tell you one more thing that my father brought me
What?
new tablets.
Mm-hmm.
New
Okay.
tablets.
Yeah. Okay, let's continue first. That's why for that, it's better. I will. If you have a UTI, I don't know if what in Thai, what are the terms that you are using here in Thai, the urinary tract infection. It's better you will going to drink coconut water early in the morning. You will drink coconut water. That is good for urinary tract infection. It is very good for urinary tract infection. Okay? Remember that one. If you have coconut in your house, then just wait, someone's calling me in the hospital. Just a minute.
Oh man. Oh, come on.
I will answer it later. Okay, so who have coconut in your house? Coconut trees
I
in
don't
your
have it.
house. In your house.
I don't have.
Okay, if you don't have, maybe if you there is a time it's better you will drink coconut water compared to colas.
Need to buy it.
Okay, so let's continue. So here, these are some example. Pink eye. We tackled this one already last week, but I need to repeat this one again. Pink eye. So pink eye cause redness and itchiness in one or both eyes. So the two eyes. As a contagious disease, pink eye can be spread by sharing personal things such as towels, wash clothes, and tissues with infected people. It is caused by germs. So sometimes we have a pink eye, right? Especially when you traveled with motorcycle. If you will go by motorcycle, and when you go back home, your eyes is reddish or pinkish. And sometimes the reason of that one is irritated. When you go what do you call this? Motorcycle, and you wear some helmets that is not yours, and that person is infected with the same like sore eyes. That is sore eyes. You call that one sore eyes. Maybe there is a possibility that you will be transmitted. You will be transmitted with the same things also. So be careful of it. And if your eyes, for example, your eyes is itchy, don't scratch it. Don't scratch it so that it will be prevented by infection.
Help. My eyes is
No.
it's
Don't scratch of it.
ah,
Yeah, it will be. Do you know why? For example, there are some stony parts in
Oh,
your
my
eyes,
eyes.
and you will scratch it.
Teacher,
Then maybe your eyes will be infected or it will be irritated.
no, my
It's
eyes.
better you will going to wash your face or you can go to doctor and they will give you some drops to clean up your eyes.
Help, help.
Or
My
you
eyes.
can wash, just try to wash your face.
Teacher,
Yeah.
itchy. My eyes is itchy.
Why is it itchy? Don't scratch it if your eyes is itchy. Okay, so let's continue. So there is a reason here. What should you do? So what you will going to do if you have a red eye or pink eye? First, do not rub or touch the infected eye. Okay, as what I've told you, do not touch it. Do not do your eyes. You will open your eyes and you will going to scratch or you will going to put tissue. No, don't do that one because it will be irritated or maybe it will be having infected. So next, look at the picture. When using a drops, try not to touch the tip of the eye drop bottle. So if you have already a ready medicine for eye drops in your house, this one, the open bottle in your drop, don't hold it. Maybe there is a germs in your hands. That's why don't touch it to prevent infection. Don't try to touch. Then next one, look at this one. Wash your hands with soap regularly. So you need to wash your hands before you will going to do like this in your eyes. Just wash your hands because there is a time.
May I go to the toilet, please?
Okay. There is a time that we cannot, what do you call this? We don't care or we didn't expect that we touch our eyes the same like this. We do like this. That's why you need to always wash your hands because there is a time that we do like this, we do like that, and we don't know our arms have a lot of germs, and maybe that is the cause why you have a pink eye or red eye. Next, the fourth picture. So use eye drop or eye ointment only for infected eye. So if you don't have an infected eye, don't use that drop or any antibiotic drops. Don't use it. Don't use. Always consult a doctor if you have a red eye. Do you understand, class? Be careful of it. Our eyes is very important. We need to be what? We need to be take care. So next, what was that? Do not share your eye drops, handkerchief, or other personal things with others. Okay, I would like to ask you, your towels in your house, did you use your own towels or you share with someone?
Own towel, own handkerchief.
Okay, Ranchida, she has her own towels. Why now?
I use with my mom a little bit.
How about the others? Who have a shared towels?
No, that's my family.
Yeah. Maybe it's okay with your family, but it's better if you will have your own towels.
My Doraemon one.
Yeah. But when you are with your friend, when you are with friends, especially when you are in school, and if you don't have tissue, and you can see to your friend, she has or he has a handkerchief. Do you know what is handkerchief? Do you know what is handkerchief? Do you know what is? It's the small one. It's the small one. Supposed to be tissue, but it's cloth. We call that one handkerchief. Don't share your handkerchief to anyone. It's not hygienic to share your handkerchief to everyone. You need to use your own handkerchief. Because you wipe that one to your face, you wipe that one to your nose. If you have your, what do you call this? If you have your runny nose, you will wipe from your nose, you will wipe from your sweat. So you don't know it. At least that is your own germs. That is your personal use. And if you will share, for example, you use that one, and if you will share to someone or you borrow it, you can get any bacteria from them or any germs from them. Next. Last one. Avoid going to school to prevent the spread among your classmate. Okay. If you have a red eye or pink eye, if you have that one, that is the contagious red eye or pink eye. It tells there, don't go to school. If the doctor tells, this one is, what do you call this? Transmitted meaning to say, if the doctor says, this red eye is transmitted, meaning to say, you have, then you can contaminate with others. Meaning to say, the same like COVID. If you will go nearby with the COVID, you can be transmitted. The same as that one also. Red eye or sore eyes or pink eye. If you will go to school, then you play with your friend, then it will be transmitted to anyone. So it's better if you have that case, it's better you will stay at home and you medicate in your home. Just wait until you will become okay. So let's go to the next page. So that is the red eye or sore eyes or pink eye. You call that one. So you know it already, how to prevent it. Now we are going to go diarrhea. Do you know what is diarrhea?
อะไรที่เราไม่เข้าใจเนี่ย
Yes,
เราวงเล็บ
yes, yes.
Do you know what is diarrhea, right?
Yes, yes.
Okay. Who among of you have tried or experienced diarrhea?
My father Monday or Sunday, but it's not already.
Yeah.
My father is my father.
Oh. So who else? Who among of you have tried for diarrhea? Does anyone who have tried, who have experienced to have diarrhea? Do you know what is diarrhea?
My brother.
Do you know what is diarrhea?
My brother has diarrhea like.
Yeah. Who among of you don't know diarrhea? Diarrhea. What is pasatay and diarrhea? I don't know.
ท้องเสียท้องเสีย
Huh?
ท้องเสีย
Always
เรา
poop.
เป็นท้องเสีย
ท้องเสียไงอ่ะ
มี
So what is your, okay, I will ask you, China
เย่
Chop. You have experience already to have diarrhea. So what do you feel? What do you feel from your body when you have diarrhea?
มีเธอ
Where is the painful? Where is the pain?
บัตร
But what else? Where?
and stomach
Yes, stomach. Mostly if you have diarrhea, you have a stomach ache, right?
yes
yeah
Yeah, if you have a diarrhea, oh my stomach pain, man, my stomach is pain. What will I do? Yeah? You're laughing. Oh, then you're always running to the toilet. You want to poop. Yeah, watery, normal stool.
no I just poop
That is real. That is real.
I just poop one at a time one at a time
Yeah, for diarrhea, severe diarrhea, always, all the time in the toilet. Yeah. What is the reason? Why is the
you don't
reason?
wanna go out
Most reason why you have diarrhea. So what is the reason? Most of the reason is just because of what? What do you think? Any idea? Can you give me an idea? What is the most reason why we have diarrhea?
vegetables
Pardon?
eat vegetables
No, it's not can cause diarrhea eating vegetables.
not eat cola
I mean, what is the reason why we have diarrhea? Some reason that you know. Tamay, you may diarrhea. Why? What is the reason?
eat
What do you think? What is the reason why we have diarrhea?
eat what
eat unhealthy
It's unhealthy, but the main reason is because you have eaten that is not unclean. Meaning to
my
say,
God.
yes, that is of the food is unclean. Unclean meaning to say there is a germ, so there is a bacteria of it that you think that is clean. You're thinking that is clean. But for example, do you know flies? Flies?
yes
Okay, do you know flies? Your food, you didn't cover your food, you left. For example, you're eating steak, chicken steak. Then supposed to be you're eating. Then you go outside. You are outside, right? You're eating. Then you go and play. You left your food without cover. Then you go and play. Then the flies fly to your food and stay. The flies stay there for how many minutes? Then there is a possibility that flies laid egg to your food. And
what
yeah, and when you go back to your table and you eat, you don't know it's clean. You can see it's clean. You don't know there is a fly's egg there and you eat.
and
Then that is the one reason why we have stomach ache, just because you ingested the germs or bacteria inside of you. Then you will going to have a diarrhea. That's only example, that's only example. Okay, I will give you. I will see if there is example that one, because lately I downloaded it, but
Wow.
I lost it.
but you say you're a nurse
Yeah, that's why I told I am a nurse. That's why I am telling you that is the reason. But I just only want you to see a video, a real video, the same as what I've tell. Yeah, because do you know, you need to be, what do you call this? You need to knows it.
Psycho.
Yeah, you need to knows it. You need to be, what do you call this? You need to know what are some reason, at least while still you are young, you know what is the reason.
We don't know. Everyone don't know.
Okay, so here, I will show you a video, at least you know it, with some bacteria. There's a lot. Okay, here. Wait, I will close this one for a minute so that I can share the. Yeah. Okay, here. This one first. Can you hear it? Can you hear?
No.
Just wait, just wait.
Diarrhea. So in this lesson, we're going to talk about
Can you
what
hear
this
now?
condition is. We're also going to
Yeah.
talk about some of the
Okay.
causes for getting traveler's diarrhea. We're also going to talk about some of the signs and symptoms, how we can diagnose it, and how we can treat it. So traveler's diarrhea is actually the most common illness in travelers visiting resource-limited areas. Approximately 50% of travelers to resource-limited areas will experience traveler's diarrhea. And traveler's diarrhea, those things is infections like traveler's diarrhea. Another risk factor is antibiotic use. So why this happens is because when you take an antibiotic, you can kill some of the gut flora, some of the commensal or good bacteria in your gastrointestinal system. So when you do that, you allow certain pathogens, certain bad bacteria to get in and flourish. And this can be one cause or one risk factor for getting traveler's diarrhea. And being a younger or older patient can increase your risk for traveler's diarrhea as well, because younger and older patients, especially ones on the far extremes of the age spectrum, they have a reduced immune system function. As you get older, your immune system function decreases, and as you're younger, your immune system is just developing. So these are the reasons why you have an increased risk for getting traveler's diarrhea when you're younger and older. Another risk factor is concomitant health conditions. So other health conditions that you might have. These include things like diabetes. And with diabetes, you're going to have some immunosuppression, which also leads to increased risk of infections like traveler's diarrhea. So what are some of the causes of traveler's diarrhea? We actually break down the causes of traveler's diarrhea into three categories. The first category is bacterial causes. So bacteria are actually the most common causative organisms of traveler's diarrhea. And in fact, enterotoxic E. coli or ETEC is actually the most common cause. And it's the most common bacterial cause, but also the most common cause in general. And it actually accounts for nearly 1/3 of cases. So it's a major cause of traveler's diarrhea. We can see enterotoxic E. coli causing an enterotoxic non-inflammatory acute diarrhea or watery diarrhea. We can often find ETEC being more common in developing nations where there are contaminated water sources. Another cause of traveler's diarrhea is Campylobacter jejuni. So Campylobacter jejuni comes from uncooked or undercooked poultry, and it can also spread between individuals. It is highly contagious. It causes an invasive or inflammatory acute diarrhea, and it causes a bloody diarrhea. Another cause is Shigella, and Shigella can also lead to a bloody diarrhea. And we can also see Vibrio cholerae being a bacteria that can cause traveler's diarrhea, and we can see this in impoverished areas or impoverished nations. And it's usually in contaminated waters. And You can also get this from eating foods that were cleaned with contaminated waters. Another bacteria is enteroinvasive E. coli, or EIEC. And another bacteria is Salmonella. We can get this from uncooked or undercooked poultry again. This can lead to a bloody diarrhea as well. Less common bacterial causes of traveler's diarrhea include Bacteroides fragilis and Clostridium difficile. So Clostridium difficile is associated with antibiotic use. So as I go through and describe these bacteria, you might be wondering what I mean by enterotoxic diarrhea or invasive or inflammatory diarrhea. If you want more information on those topics, please check out my acute diarrhea lesson. Another category of pathogenic causes of traveler's diarrhea is viruses. The most common viral cause of
Okay. Another one is here. That are some causes. Here, with the picture, I will give you with the picture. What kind of food that cause diarrhea? Mostly if you have travels, if you eat some what do you call this, some unsafe food can cause diarrhea.
And Mexican food, along with anything with Mexican or Asian style dishes, it acts as a powerful laxative. Also, sauces such as sriracha, tabasco, or anything that contains hot peppers might give you a crappy feeling. That is because your digestive system can sometimes be irritated by the capsaicin.
So here.
The diarrhea.
But this food doesn't mean that you have all of it have a diarrhea. There is a reason why you have it.
Oh, chickens. I poop it. When I eat chicken, I poop.
Yeah. Okay. There are some, do you know sriracha, the hot sauce peppers, the one that she showed? There are some people that if they will, not all people, but there are some people who ate spicy food, the same like this one, the Tabasco. The Tabasco. They will have the diarrhea of the spicy things.
My dad loves spicy things.
The digestive system can sometimes be irritated by the capsaicin from all varieties of pepper. Capsaicin burns and irritates the skin. Number 2, artificial sweeteners. Artificial sweeteners. Number 2,
Artificial sweetener, artificial sugar.
If you watch your waistline, you probably reach for products that contain artificial sweeteners. Artificial sweeteners and sugar alcohol.
You can get that one in your colas.
Laxative effect and can give you diarrhea. Check the ingredients. Advertised as lotion.
Beer?
No, that is wine.
Saccharin, sucralose,
Oh,
sorbitol. Also, fructose is a natural sweetener.
sugar.
Be associated
Yeah.
with diarrhea when consumed in large quantities and send you running to the bathroom. Number 3, high fiber.
Vegetable. Flat.
For high fibers,
Moderation.
it can
I like
cause
broccoli.
diarrhea.
Eating large quantities of vegetables like broccoli and cauliflower, or fruits like figs, raisins, and star fruit can deliver too much fiber to our digestive system.
So these are food that's too much fiber that can cause you diarrhea. But it doesn't mean that you have a bacteria inside. But this reason is just because you have a lot intake of fiber. It doesn't mean that you have diarrhea, meaning to say, you have a bacteria, ingested bacteria. No, this one, you just eat too much fiber. That's why you have a diarrhea. The same like this, the star fruit.
A meal, making it difficult for the body to digest. That's when healthy foods become foods that can cause diarrhea. Eating fiber is necessary for your health, but too much fiber can sometimes be difficult for your digestive system to handle. Number 4, alcohol. Alcohol can often cause diarrhea the following day. If you experience this unpleasant side effect, monitor your consumption. Drinking beer or wine in large quantities can irritate your digestive tract and cause trouble. So watch out for consuming too much of a good thing. Don't be a party pooper. Number 5, caffeine. If you feel white and crave a caffeine fix, it's hard to avoid strong coffee and beverages with caffeine. But too much caffeine can cause a
ไว้ตายเลยนะ
consumption. Drink double or an energy drink and often find yourself quickly running to the toilet. Lowering your caffeine intake might be the way to go. Number 6, milk. If you're lactose intolerant, milk and dairy
Oh, the same as what I've told you. This one, milk, right? Do you remember what did I told you about the lactose intolerance? The same as Teacher Joy. Milk is healthy. Do you know that already, right? But there are some people who cannot drink milk. The same like me. I have a lactose intolerance because if I will drink milk, the same as that, I have a diarrhea, or sometimes I have a stomach ache because it cannot digest. Meaning to say that you intake bacteria. No, that is one kind of illness that you have or sickness. So be careful of it.
products can cause you to have diarrhea. Cream, milk, cheese, and other dairy products can be the problem as your body lacks the enzyme to break down the sugars found in dairy items. So if you can't resist that delicious ice cream on a sunny day, then have a list of public bathrooms at home. Number 7, fast and fatty foods. Fast foods such as French fries, cheeseburgers, or fried chicken are finger looking good, but anything deep fried is high in unhealthy fats, which can be challenging.
Run to the go now.
Fries and hamburgers to avoid fatty foods, or you might not be able to hold it in. Try grilled chicken and turkey or veggie burgers.
I like it.
Gluten.
You
Gluten
like
is a
French
protein
fries.
found in wheat, rye, barley, beer, and bread. People with gluten sensitivities can have a hard time digesting gluten.
Oh, I like pizza.
Oh, you like pizza?
If gluten is
I like bakery.
Oh.
diarrhea, you'll need to avoid foods that contain it. Don't be a glutton for gluten. Do you find yourself farting a lot? Watch my next video about popular foods.
Okay. So this one, we will continue it next week because I didn't notice. You didn't tell me. It's past time already. Yeah. So we will going to continue this one next week. So remember, class, that not most of it that you have going to have diarrhea, meaning to say that all the time you have a bacteria. There are some reason that why you have a diarrhea, but mostly you have ingested the germs or bacteria. That's why you have the diarrhea and stomach ache. And there is also times that we can treat it at home, that diarrhea, but there is chronic diarrhea that we cannot treat it at home. Just even what we will going to intake medicine in our home, we cannot treat it. So we will going to continue that. It's very interesting lesson. It's very interesting lesson. So we will going to, yeah. We will going to continue that one next week because it's past time already. So everybody say thank you, teacher.
Thank you,
Okay, bye-bye. See you.